All right. Good morning, everyone. My name is Ben Bahanowitz. I'm a Director of Client Services at Employee Benefit Services. I am excited to introduce our co-host today, Phil Baker. Some of you are familiar with Phil. You definitely know he's not your average pharmacist. Phil's been an absolute game changer in the world of healthcare. For those of you that are unfamiliar with Phil, I'll give a brief background on him. It's kind of uncomfortable to talk about yourself, so I'll do him the pleasure of talking about him for him. Phil started in the retail space from a pharmacy perspective in a very well-known grocery store chain. I think he'll be the first to admit that he quickly realized that in that retail-based pharmacy, the main priority was really the volume or the quantity of medications that were being sold, essentially pushing pills, not necessarily caring for the patients or putting the best interest of the patients first. Phil left that retail pharmacy space, became a director of pharmacy for a local rehabilitation hospital. But really, I think Phil's major foray into what we have today is when he had a brilliant idea to create one of the first nonprofit membership-based pharmacies that primarily focused on uninsured or underinsured patients, but it was all about the quality of care. He wanted to make sure that people were getting the right medications at the right cost, all while receiving a really, really good experience. And that same concept really rang true in the employer side of things. Phil began created an organization called Halo Scripts that works with self-funded employers where they do the same idea, concierge pharmacy, really working with patients who take a lot of ongoing maintenance medications. And it aligns all the interests of the patient, the plan sponsor, and the pharmacy together. So everyone gets a really positive experience, a really cost-effective price where it drives savings for everyone that's involved. And so, again, very excited to have Phil Baker here. He's a true innovator in healthcare. We're lucky to have him present our webinar here. We've gotten a lot of interest in Humira over the years. It's certainly been a major cost driver for a lot of our self-funded plans. And so I'm certainly excited to hear what Phil has to share in terms of insights and experiences that'll definitely be very beneficial for our employers and patients taking Humira. So Phil, I will turn it over to you.
Thank you very much, Ben. I'm going to turn my camera on just for a second so I can say thank you, Ben, for that wonderful introduction, and also just to thank everybody for taking the time to do this meeting today and hear the information that we have to share. With that, I'll turn the camera back off so we can focus on the slides here. So what we're going to talk about today is the financial burden of Humira on health plans, the new biosimilars that have come out that produce a really great opportunity for cost reduction, strategies to reduce costs, and next steps that you can take for immediate impact. We intend this to be pretty much just hit the high ground. Nobody has time for a really long webinar, so we want to do about 20 minutes of presentation so we can get right to questions. So I'll go pretty quickly. Please feel free to interrupt me at any point if you have a question about anything I'm talking about. I'd really appreciate it. So what is Humira? Humira is a biological medication. Technically, it's a TNF blocker. And essentially, it is a drug that works on autoimmune diseases. And there are a bunch of, some of the worst being lupus and some of the most common being psoriasis, just on the spectrum. It blocks the protein that creates the problems, if you will. And it's a wonderful drug. It really works well. The problem is it's about $7,000 a month. And so because it is so prevalent, it's used for so many different conditions, it's so expensive. In 2022, $18.6 billion in the US was spent on this. There's some confounding factors as well. It's a specialty drug, so it'll fall in the highest tier on your plans. And it's not just the medication. The patients who need this medication have chronic diseases. So there are testing costs associated with that, follow-up appointments with multiple specialists. And so all of these compound to create this huge kind of financial burden for the plan with patients that are on this drug. So what's been the biggest kind of thing to come down the pipe in the last several years are biosimilars. And so everyone has heard of generics. Biosimilars are kind of like generics for these what's the word I'm looking for these class of medications. Biosimilars are not generics. They can't automatically be switched, but they're close enough that the FDA allows them to be tried out in the same vein as the original Humira. So I'm being careful and cautious not to say that there are generic Humiras, but the net effect is essentially the same. And so this year alone, there have been 9 major biosimilars that have come out. This slide shows you guys those. The take home here is Humira at the top, like I said, just about $7,000 a month. And then these biosimilars range anywhere from just shy of that, $6,500 a month, all the way down to about $567 a month for Usimry at Mark Cuban Cost Plus Pharmacy. The real take homes here are the ones to look at, I guess you'd say. The third one down, the Saltezo, is the only one right now that's currently interchangeable with Humira. What that means is the pharmacist, if the patient has a prescription for Humira and takes it to the pharmacy, and the patient says, I'd rather have this, try this biosimilar, the pharmacist can automatically just make that switch. It's interchangeable. He doesn't have to call the doctor to get a new prescription. They're identical. With the rest of these, to switch a patient over, you're going to have to get a new prescription for that specific biosimilar written for that drug specifically. So interchangeability is a big deal, and it's what all of these biosimilars are kind of in line with the FDA to get as soon as possible. The second thing is this Usimry, you can see, is the least expensive. Mark Cuban Cost Plus Pharmacy. This isn't available yet, but it's been very much publicized. It's coming down the pike. And so I want to just put that caveat out there that you can't actually get that yet.
And I think, Phil, one thing that would be important to add here, the maker of Humira, a company called AbbVie, certainly sees their market share probably dwindling or potentially to dwindle with the introduction of these biosimilars and the competition that'll probably ensue in the marketplace. They're trying to still grab as much market share as possible. Humira, as in the last quarter, has increased their rebate on AbbVie's increased the rebate on Humira up to 60% of the list price of the medication. Again, it's important to note, if you're in a plan sponsor scenario where you get 100% of your rebates back, that's fantastic. But if you're in the form of a PBM contract where maybe you don't get your rebates back or you don't get all of your rebates back, it's certainly going to be in your best interest to try to look for the lowest net cost medication that's out there. That certainly is an opportunity for savings. And so they didn't go the route of reducing the list price. They went the route of increasing the rebate, which, again, depending on your PBM contract, can certainly have some implications in terms of the net cost that you can receive for members filling that medication. Anything else to add there, Phil?
No, that's really that's it.
Okay.
So what do you do about Humira? Most of you guys probably have most of these in place. Prior authorizations require prior authorization to ensure it's medically necessary. Step therapy require, trying certain less expensive meds before going to the most expensive one. You probably have a tiered formulary where putting biosimilars on the lowest cost tier so that the copay is less for the biosimilar than the Humira could be a strategy for you. All of these involve a lot of patient education. The patients need to know that the medications are safe, that they're equivalent, and they're, of course, cost effective is kind of just wrapped in with that. So strategies for implementation when it comes to prior authorization. What criteria should you use for prior authorization to ensure Humira and its biosimilars are being prescribed appropriately? This is done through diagnosis confirmation, failure of first-line treatments, regular monitoring for efficacy and side effects.
Team, I think in the vein of prior authorization, that tends to be a not so nice word when we talk about experience. But again, as you looked at the list price that's available for Humira, even with the rebate, there are lower cost alternatives that are coming down the line. And the really only real roadblock that you can potentially put in front of a member from simply filling Humira versus going to a lower cost alternative would be that prior authorization method. And so again, for groups that are looking for those cost savings, the prior authorization process would really be that front line of defense that would give you the ability to see if it's possible to try a biosimilar in the beginning versus potentially looking at going strictly to Humira. And I think that leads us right into step therapy, Phil. So I'll let you
It
take it
sure
from there.
does. Yeah, yeah. So before you implement, the expensive Humira, there are other medications that can be tried, tested out that may work for the patient before they have to go on the super expensive drug. And so most of those are called disease modifying anti-rheumatic drugs. Methotrexate is one in that family. In most cases, if your patients are already on Humira, they've probably already tried these things, though. And then question 3, patient education. What resources can we provide to plan members to educate them about biosimilars? And so this is where it's tough. This is very new information. You guys know this. It's probably why you're on the webinar. It hasn't really trickled down to patients very much yet. And so it's really important to have a medication management program that includes educational materials, consultations, and a dedicated pharmacy team that can offer valuable information directly to the member and help them convert to one of these.
Phil, I think there's probably some context that we could add to that end.
Okay.
At the end of the day, team, pharmacists, doctors receive their information about drugs they're able to prescribe mainly through pharmaceutical reps. And you can certainly make the argument that AbbVie probably has more reps that are circulating around doctors' offices than potentially some of the makers of the biosimilar medications. And so I think it's certainly important in the context of educating members that it may not necessarily come directly from their prescribing provider about different biosimilars that could be less expensive for them or less expensive for the plan. It really is going to originate out of a different source that's able to educate the member on the effectiveness of biosimilars and the impact it can have not only for the savings on their part, but also for the plan sponsor side of things. And so again, really doubling down on the aspect of medication management and a program that's designed to interact and engage with members to provide that education is going to be key for a member being comfortable moving over to potentially a biosimilar that, again, is designed to have the same effect as the current specialty medication, but at a much lower price.
Excellent. So 4 actions for plan sponsors, things that you can get started on right away. One is to take a look and do a financial analysis, look at your claims and see how many folks you have on Humira that could potentially, represent a savings. Engage with your PBM, make sure biosimilars are included on your formulary, that you're doing the prior authorization process, that a step therapy is in place. And then a medication management program, inform members of the changes and how it may affect their treatments and cost. Again, that patient engagement, the patient has the right to just say no at the cash register, essentially. So it's really important, the education and the engagement with the patients. And then from there, ongoing, like if you're successful and you get a patient to transition to one of the biosimilars, but they don't like it, then you really need to be following that. And also, people are getting prescribed these medications. Maybe an existing member who wasn't a Humira patient yesterday could very much be one tomorrow. And then you guys know you have new people as well coming on the plan all the time. And so it's really important to continue to track it.
Team, I would certainly think that for most of us that have a good PBM relationship, there's already some strategies that are being formulated in place. I would certainly check with your PBM. Hey, what's our overall strategy? Where are you going to have biosimilars on the formulary? Is there incentive for member potentially with a lower copay? How do you influence the prior authorization process? Again, all of those can be pretty important. Again, I think one of the major steps for the 4 action plans here would definitely be discussing with your PBM. But at the end of the day, that we know a member's probably going to get the best education, not necessarily from a PBM about a potential drug, but either from a pharmacist or from their doctor. And so I think more importantly, if there's a goal to potentially move folks to a biosimilar medication, again, has the same efficacy and has the same or lower cost, a medication management program is going to be pretty key to having that change be successful. And then monitoring that over time, as Phil mentioned, we see Humiras pop up all the time on our plan. As we kind of pointed out in the beginning of our presentation here, there's a lot of indications, everything from rheumatoid arthritis, plaque psoriasis, Crohn's disease, ulcerative colitis, a lot of things that we see that are inflammation affected pop up, and Humira or one of these biosimilars are an indication for. And so we intend to see the market grow for Humira, just like it has been consistently over time. We also see the market growing in the case of biosimilars, where people are going to be looking and plan sponsors are going to be looking for lower cost alternatives. And so certainly an important team now with the introduction of biosimilars to start having these conversations, either with your PBM or a medication management program that's going to be able to support you with this initiative.
So how can Halo Scripts help? This is our wheelhouse right here. We can conduct that initial claims analysis for you, pick out the potential savings, measure what is there to be had, identify the actual target members. Once we've identified them, we can engage those members for you. And then really the most valuable thing we do is in terms of transitioning is the patient education, but then going a step further and actually taking care of everything for them. By that, what I mean is we call the doctor, we get a new prescription for the biosimilar, we get it transferred to the fulfillment center. All the patient has to do is say, yes, I'm willing to try it. And we take care of everything from there on out. And then again, maybe the most important piece, ongoing analysis, ongoing follow-up, make sure it's working for them, checking again for new opportunities. We do our analyses every single quarter, every calendar quarter for all of our clients.
So team, I know many of us on the call are already existing clients of Halo Scripts. And so this is a piece that we're going to factor into the ongoing quarterly analysis that already exists, where we look at all claims data. But since we have biosimilars that have now hit the market and we can see that there's meaningful cost reductions in some of the biosimilars that are available, we'll start influencing that with the ability to hopefully get lower cost medications for those specific indications. And for those of us that are unfamiliar with Halo Scripts, again, Halo Scripts is a concierge pharmacy that works with plan sponsors that can, again, do things like this, but it's designed to be a medication and pharmacy management program that provides a really good customer experience, but also lowering costs for the employer and the employee. And so I think we're a little early, Phil, but I think we're probably right on here in terms of timing. A couple of quick things I do want to mention. We are doing a pharmacy management series. We have 2 more webinars that we're planning on introducing here in the next few months. One question I think that all of us have gotten, if you're in the healthcare space, is the question around the weight loss medications, specifically the GLP-1s, Ozempic, Wegovy, Mounjaro, Rybelsus, Saxenda. We'll be doing a webinar on those medications, how to best cover them, some of the truths behind those on November 2nd at 11 a.m. And we also have a really exciting webinar coming out specifically on prescription adherence, which for many of us, if you're unfamiliar or familiar with it, it is a major problem when it comes to people taking the right drugs at the right time. There's a lot of barriers that exist for patients why they are unable to adhere with medication regimen, and some solutions ultimately to address that. And so team will be posting out additional details and information on our LinkedIn company pages at our Employee Benefit Services of Maryland and Halo Scripts. And so if you're ever looking for more information about our webinars, you can certainly find us there, or emails. Our email signatures often include those as well. But with that, team, I think we'll move on to get in touch and thank you and questions. And so, team, I did see a question come through. Shannon, you got a question. What is Mark Cuban Cost Plus Mark Cuban Cost Plus Pharmacy? Mark Cuban, it's the same Mark Cuban that most of you are familiar with, created a pharmacy where they are looking to sell popular medications at a cost plus price, meaning they get whatever cost they can get that medication for, similar to how an acquisition price works within Halo Scripts. They put a 15% markup on it. And then they charge administration and shipping fees and ship it directly to the member's door. It hasn't made money yet. It's still, Phil, would you say, I don't want to say it's in infancy stages, but I think it's
a startup.
It's a startup. Again, they're not profitable yet. I think there's a long road to profitability there for a company like that, trying to undercut the market, but it's certainly a step in the right direction of transparency and cost alignment with people that pay for those medications.
He's been this is a kind of a revolutionary model to go, cost plus. And so he's been getting a lot of attention and shining a lot of good attention on price transparency and the high cost of medications. And so it's been good for that point. They're looking ultimately to get into manufacturing. They're opening a manufacturing center in Dallas. And so it's something I mentioned because it's something you kind of need to be aware of. It's on the horizon. There could be basically an alternative option to PBM contracting if they're successful there. What they're doing with the Usimri, which is a biosimilar of Humira, is they're basically selling it with no rebate. They've got the lowest price. I think most pharmacies get it for about $1,000, and they're going to sell it for about 500. Yeah, here we go with this slide, 567. And so that's the first time they've forayed into brand name drugs. They've been pretty exclusively with generic drugs. And so just another signal, if you will, that this organization may be around for a while and that they're doing pretty innovative things. The problem here is that they don't contract with groups yet. And you have to convince your members, you'd have to convince a member to transfer individually. You can't just contract for the whole group. So it's a little tricky yet. And while this price is great, it's half of what everyone else is. Like I said, it's not truly available yet. It's supposedly coming very soon. So that's Mark Cuban, the Mark Cuban Cost Plus Pharmacy story.
Team, what other questions do we have? So in terms of next steps for some of us that are already Halo Scripts clients, we're really going to be keeping a close look on where we're able to obtain the lowest cost price for these biosimilars and how that ultimately compares to Humira with the increase in the rebate cost and the rebate share. And so again, it'll be a constant exercise for us each and every quarter as the market evolves to say, are we able to find a lower cost than where it is today? And does it make sense for that member through education to move to that to that medication? And so, again, an ongoing exercise. This market will certainly continue to evolve. You're starting to see the beginning of list prices coming out, FDA approvals, the responses in terms of the legacy player here, the incumbent major supplier, AbbVie and Humira, in terms of raising rebate shares. But we certainly expect this to be pretty fluid over the next year or so as they're jockeying back and forth for market share on how to best price this medication, since there's going to be so many options available now for members to be able to choose from. Phil, anything else you'd add there in terms of what we could expect to see in pharmacy pricing?
No, I would add only this, that this is an upcoming trend, if you will. There will be biosimilars of other super expensive medications in the next couple of years. There's several that are lined up to come out. And so thinking of the process of new biosimilars available, how do we transition patients? This is just going to be part of medication management that you're going to need to include in a good, robust program. And it's something that our clients are going to start seeing this quarter with any patients that are currently on Humira. We're going to be having this conversation. And then as these biosimilars come out for other drugs as well, it'll be more of the same.
Do you have any other questions? All right. Phil, thank you for putting this together. Certainly educational for myself, hopefully for the folks that are on the call here. And we hope that you come join us for our next webinars, again, focusing on our weight loss medications, which seem to be a very hot topic, as well as the medication adherence. So more information coming out on our channels, and you'll also get our email invites. So we hope to see you there. But thanks everyone carving out time this morning. Thank you again to Phil, and we'll see you again shortly.
Thank you all. Thank you so much. See ya.